Have you ever wondered what the difference is between upper cervical specific chiropractic care and traditional chiropractic care? I'll tell you the difference. I'm Dr. Norris Goldberg, and I'm the owner and clinical director here at Chiropractic in Louisville, Colorado. I'm a NUCCA certified chiropractor, which means I'm an upper cervical specific chiropractor, okay? Now, traditional chiropractors will traditionally adjust the upper neck, and sometimes it works, sometimes it doesn't. A lot of times you'll hear a big pop or crack, but what I have found, because I see many patients who come to me from upper cervical chiropractors and traditional chiropractors, if they're not doing a thorough enough approach in terms of their corrections and they're not actually fixing the problem, you're still going to find a lot of signs of the upper cervical misalignment. And so with NUCCA, what we often find that people will have a lot of what we call postural distortion, right? Their head won't quite sit straight, maybe one shoulder's a little high, their hips are high or unlevel or twisted, the one leg will be a little bit short. This is a part of the neurological compromise that happens in the atlas subluxation complex, or the ASC, okay? So when you have an ASC, what happens is that there's a big twist at the top of your neck, and it's putting pressure on your brainstem, essentially, just to keep it simple. There's a lot more to it than that, but it's affecting your neurological function, which is ultimately distorting your posture. You're compensating for the fact that your head doesn't sit quite straight. So you're not gonna walk around like that, so you do this, okay? Now, with traditional chiropractic care, again, you're gonna hear a big pop or crack, and for some people it works. And if it works, great, right? But a lot of people who are coming to see me have tried that and have tried other approaches, but they have more complicated problems. Maybe they have chronic issues like arthritis. Maybe they've had multiple injuries, whiplash injuries or concussions or traumatic brain injuries. And a lot of times they're dealing with neurological symptoms. So easily they'll have, not always, but neck pain, headaches, numbness and tingling, vertigo, dizziness, sometimes Meniere's disease, vestibular migraines, right? There's a lot of things that do really well with upper cervical chiropractic care, right? But there's definitely a difference between traditional chiropractic and upper cervical chiropractic. Other differences are that we use a very advanced form of assessing your spine or analyzing your spine. In our office, we've actually upgraded to what we call a cone beam CT or a CBCT. This gives us a 3D image, just like when you go to the dentist, you get a little scan of your jaw these days. We do a scan of the whole head and neck. It's actually the equivalent of like one X-ray in terms of radiation. So very, very low dose, or some people would even call it ultra low dose. So it allows us to see things very clearly, both in 3 dimensions and also in the typical CT way that we can see like the slices, right? So we can really analyze things and get the very precise measurements. Not that we couldn't before with 2-dimensional X-rays, but we had to take a bunch of X-rays from different angles to essentially come up with a 3-dimensional measurement, right? So, your atlas bone, it can move forward and back, it can move side to side. There's gonna be, compensations at your adjoining joints. So like C2 is gonna rotate, your occiput is going to move in a certain position, and ultimately that's why we call it the atlas subluxation complex. We adjust the atlas bone, but we're able to fix not just the neck, but really the whole spine. We can see results throughout the body, and it's done with a very gentle and specific adjustment, okay? So, I do NUCCA. That's my bias. I found it to get the best long-term results, and typically we get people to start holding their adjustments even after the first adjustment for several weeks or even sometimes several months. And it's very reproducible and very reliable. So usually, even if you're seeing other NUCCA doctors, you can get the same adjustment and it's gonna last usually just as long and get you the same good result, okay? So there's also other upper cervical techniques that are also considered specific that are very good. There's knee chest, there's orthospinology, atlas orthogonal, Blair, and like I mentioned, NUCCA, right? So if I couldn't find a referral for a patient who's maybe out of state or out of country, the first thing I'm gonna look for is at the NUCCA directory. If I can't find someone there, maybe I stay with another, what we call orthogonal approach. So atlas orthogonal and orthospinology, we analyze the spine in very similar ways, but they do, instead of a hand adjustment, they use a little instrument adjustment. So it kind of looks like a little kind of probe or space needle that adjusts the atlas bone. I prefer to use my hand. I think that there's a lot to gain from that. I can feel a lot of what's happening. And again, it's very gentle. It's not any big thrusting, pushing, cracking. It feels like a gentle pressure, okay? And it gets us a very specific result, okay? So what we can see is we actually do an image before and then after the adjustment. And so we won't even do that second image until we see significant postural changes, right? Once we see that, we know that we've more or less realigned things. Like let's say you come in with a half inch high right ear, right? And then I adjust you and it's level, and your hips level out and your legs level. That means I've gotten the stress off the nervous system, pressure off that brain stem, and most likely gotten a good correction. But sometimes I go back in and I scan you again and I realize there's more improvement to be had, right? And ultimately what we know in NUCCA is that if we get as close to perfect or orthogonal, where your atlas is level and your spine goes up and down, your head goes up and down, it's going to get you the best long-term result, right? The toughest cases are oftentimes ones that are really hard to straighten up again. But once we get them straightened up and we figure out what that perfect angle of adjustment is, they usually get really good long-term results. And again, it's with really complicated neurological conditions. Oftentimes they come with a big diagnosis. You go to a neurologist, they maybe even do some of these similar types of scans, do a CT scan or MRI. Thankfully, you probably don't have a tumor, you don't have a cancer or infection, a fracture, anything like that. However, unfortunately, the solution is usually try this drug, see if it works. If it doesn't, we'll try another drug, right? So no knocks against medicine here. I'm just saying a lot of people are looking for a natural approach, right? If you're happy with the drugs, then stick with them. They're easy. You just pop one a day, right? However, if you're looking for a more natural approach, if you're looking for a more inside out solution and you just want your body to feel better and function better, then I really consider looking at upper cervical specific care. So if you're in the Colorado area, of course, we would love to help you. We do a very thorough approach. Like going to a specialist or a neurologist. We do, in my practice, an 18-point neurostructural testing. So I'm going to take 18 different tests and measurements to be able to understand, what's the effect of the atlas subluxation complex, and then also when we correct it, and then we reassess that over time, what the long-term progress is. So fortunately, I'm able to work with a lot of neurologists, medical doctors, audiologists, ophthalmologists, people who are seeing problems with their patients that they believe don't line up with the, more typical medical approaches or diagnoses. Maybe they just are looking for a natural solution. Maybe they're not really responding to the medications, right? Or they notice something going on structurally, like that patient's coming in and every time they're talking to them, they're standing there with their head unlevel. Well, that might be something that's going on with the head or neck, right? So that's something as a NUCCA chiropractor we can help with. And again, with using a very advanced form of technology, the 3D cone beam CT scan, now we're able to see things in even more detail. Bit of a rabbit hole for me. I'm learning a lot of new things I knew about anatomy, but now I have to really assess in a different way because, again, we couldn't see these things on plain or two-dimensional film, and ultimately, it's just going to allow us to get you better results, okay? So, again, if you're dealing with chronic issues, if you've tried traditional chiropractic care, maybe you've even tried other upper cervical approaches. They all are different, and I can't say one is necessarily better than the other. Obviously, I'm biased. I think NUCCA's the best. But I've had people who maybe don't respond well to NUCCA, and they go and do orthospinology, and they get a great result, right? And vice versa. So if you're looking for something that's a little different, and if you're looking to feel better from the inside out and function better and just live your best, happiest, healthiest life, I would love to help you out. Again, I'm Dr. Norris Goldberg. I'm the owner and clinical director here at Chiropractic and a NUCCA certified practitioner. We'll see you soon.